Hi Heritage, my name is Diana Malmloff. I serve as the nursing coordinator here at Heritage. We are so excited to welcome your student back to campus. There are a lot of changes on campus and here at school due to COVID-19. Changes in how classes are structured, how the students are eating lunch, and then safety measures our students, faculty, and staff will follow, such as wearing masks. I wanted to show you some of the changes you will see regarding student illnesses and absences, and when a student will be able to return back to school, irregardless of if their illness was COVID-19 related or not. As we walk through these changes, my hope is that you will learn more about COVID-19 and why these guidelines are so important and necessary during this time. They are not easy, and we understand that you may feel frustrated and confused and even believe these to be unnecessary. Yet, during this time, following the Indiana State Department of Health's guidelines are one of the most important things we can do to help keep our Heritage family healthy. These measures will help keep our students on campus and continuing to learn. If you have any questions, please reach out to our nursing team, and you can email us at nurse@heritagechristian.net or call health services. We look forward to serving you and your family this year and working together to keep Heritage healthy.
So let's walk through the HCS COVID-19 protocol and information for parents together. We are going to answer these questions. When do I need to keep my student home? When can my student return to school after illness? What happens when there is a positive COVID-19 case at Heritage? When can my student return to school if they had to quarantine due to COVID-19 exposure? And we're going to talk about a few changes in the nurse's office this year that will be important for you as parents to know. As you know, you can become infected with the virus that causes COVID-19 when you come into close contact with a person who has COVID-19. You become infected from their respiratory droplets when they cough, sneeze, or talk. You may also become infected by touching a surface or object that has the virus on it, and then by touching your mouth, nose, or eyes, though it is believed that this is not the main way it is spread. We are not able to completely eliminate the risk of the spread of COVID-19 or stop it right now, but we can take measures to help slow the spread and decrease the spread. Some of these measures include physical distancing or staying 6 feet apart, washing your hands well and often using hand sanitizer, wearing a cloth face covering, cleaning and disinfecting things frequently that you touch a lot, avoiding touching your eyes, nose, or mouth, and staying home when you are sick. Individuals who are positive for COVID-19 can spread the virus to others when they are symptomatic. They may also spread the virus when they are pre-symptomatic, and this is up to 48 hours before their symptoms appear. Some individuals who are positive for COVID-19 do not experience any symptoms and may spread the virus without even knowing it. Symptoms of COVID-19 may vary from mild to severe illness. Some of the symptoms include congestion or runny nose, fever, cough, shortness of breath or difficulty breathing, diarrhea, nausea, sore throat, muscle pain and fatigue, chills, and new loss of taste or smell. Parents, you are our first line of defense. We ask that you review the COVID-19 daily checklist with your student each morning before you bring them to school. This was linked to in our back to school plan. If you answer yes to any of the 3 questions, please keep your child home. So the first question asks about symptoms. Is your child experiencing any of the following symptoms? And this is a complicated question. Our direction and guidance from the Indiana State Department of Health is that even just one symptom constitutes concern for COVID-19. And this is because symptoms for COVID can be very mild and unassuming, even more so for our younger students. Our guidance to you is that if it's not a typical symptom for your student, it warrants evaluation. And this gets a little hairy because if you have a student who struggles with a chronic condition such as allergies, asthma, or reflux, you know that they could experience one of these symptoms on any given day if it aligns with their underlying condition. And so if your student has an underlying condition for which they experience similar symptoms, we are asking that you call your student's doctor and ask them to write a note stating what the condition the student has and the associated symptoms, and turn it into health services so that we can keep this information on file for your student. This will be very helpful for us if your student needs to be evaluated at school so that we know what may be normal for them. And we're going to pair that information about their underlying condition with assessment details as well. And that will just help us guide what the best decision for that student that day would be, and whether it would be okay for them to stay at school, or if maybe we feel that they're getting sick and they should be sent home. So again, when you are at home in the morning evaluating your student, we want to remind you, anything not typical or normal for your student warrants evaluation. It's going to be very hard this year because of COVID-19, but we just have to be more cautious with symptoms and how we react to them and the measures that we take. Number 2, has your child been in close contact with an individual diagnosed with COVID-19, or has your child been told to quarantine? And number 3, has your child or anyone in the household been told to isolate due to a positive COVID-19 test result or COVID-19-like symptoms? If the answer to any of those 3 questions is yes, your student needs to stay home from school. I do want to point out at the bottom there are a few helpful links for you. One is, where can I find a COVID-19 testing site? And this is a link that will take you to the Indiana State Department of Health website, where there is an interactive map that will give you information about the sites in our area and throughout the state of Indiana that are testing people for COVID-19. And we just want to point out that when you're looking for a testing site on there, be sure to check to assure that they test children, as some locations and testing sites will not test children under the age of 12. So if your student is ill, you're going to keep them home from school. We urge you to call your student's healthcare provider to strongly consider COVID-19 testing. If your student is ill and symptomatic, your student will require at least 10 days of isolation unless their healthcare provider believes they have an alternate diagnosis and provides written documentation to the school that it's okay for the student to return. Isolation simply means separating sick people with a contagious disease from people who are not sick. So we're going to look at this document from the Indiana State Department of Health, and these are the guidelines for when a student, faculty, or staff member can return to school after illness. And this is whether illness is COVID-19 related or not. So you will notice there's a couple different columns. This is the individual or the situation the individual is in. So there is not tested with an alternate explanation for symptoms, not tested without alternate explanation for symptoms, student was tested for COVID-19 and tested negative, or student was tested for COVID-19 and tested positive. This guidance is all based on if the student is tested or not tested, if the result is positive or negative, or if they have symptoms or not. So the easiest way to sum up this document is that if your student has symptoms, they will need to be out of school and isolate for at least 10 days. After 10 days of isolation, and before returning to school, they must be free of fever for at least 24 hours without the help of fever-reducing medication, and have resolution of symptoms. The only way that it can be a shorter absence from school is with a physician's note stating that the student has an alternate diagnosis that is not COVID-19 and that the physician believes it is okay for the student to return to school. This note must be turned in to health services. Your student must also, in this case, have been fever-free for 24 hours without the help of fever-reducing medication and have resolution of symptoms. We are requesting that parents be transparent and open if their student or a household member tests positive for COVID-19. When parents report a positive, this allows Heritage to take the appropriate action to keep other students, faculty, and staff healthy. And here's what this looks like. Heritage will receive notification of a positive COVID-19 test result by parents reporting through the HCS COVID reporting tool or a call to health services. The COVID reporting tool was linked in the back to school plan, and it's just a form that you'll pull up. You will enter information as far as name and contact information, the relationship to Heritage that the person who tested positive has. Are they a student or a faculty staff member? Is it a parent or guardian? Information about their positive test, and then you'll submit that. And this goes directly to health services. Only nursing staff will see this. And then this allows us to, this alerts us about the positive, and then it allows us to notify the Marion County Health Department and see if contact tracing is required. If contact tracing is required, then contact tracing is initiated. So contact tracing's goal is to identify those who are close contacts. And we'll define close contact in just a moment. But during contact tracing, we work as detectives to try and retrace the steps of a positive individual. So what class were they in? What bus did they ride? Who did they play with at recess? Are they involved in athletics? Are they involved in any extracurricular activities? And we look at all of those things and seating charts and the people that they were around and try to identify those individuals who were close contacts to them. In the event that someone is positive and we have identified close contacts, parents of impacted students and impacted faculty and staff will be notified. We will notify close contacts that they must quarantine for 14 days. And then we will notify the Indiana State Department of Health who these close contacts are, because they will follow up with them to provide support and answer questions. They may reach out via text or phone, so please be sure to answer and respond to any message or phone call that you receive from them. So who is a close contact? A close contact is defined as anyone who is within 6 feet of an infected person for at least 15 minutes. The two most important factors when assessing risk after being exposed to somebody with COVID-19 is the proximity that you were to that person and the length of time in close proximity to that person. So if you were within somebody within the 6 feet distance of an infected person for at least 15 minutes, that puts you at high risk for then developing illness related to COVID-19. And that 6 feet, with being within 6 feet of an infected person for at least 15 minutes, is starting 2 days before the infected person began showing symptoms or before they tested positive until the time the individual was isolated from others. So if you are identified as a close contact, then we'll ask you to quarantine. And quarantine just means it's keeping someone who was in close contact with someone who has COVID-19 away from others to see if they will become sick. So why is contact tracing and quarantining so important? It's because close contacts are at higher risk of becoming infected themselves and of potentially further infecting others. After exposure to an individual who is COVID-19 positive, you can develop symptoms anywhere between 2 days after exposure up to 14 days after exposure. The goal is to stop the spread of the virus, to break the chain of transmission. This is what the 14-day quarantine does. There are a few other factors that may identify someone as a close contact, and they are listed here. A big one that I want to point out is living with someone who is sick with COVID-19. So household members are almost always identified as close contacts. So this would be if a parent is positive and they aren't sure about the child, but if a parent is positive, those children and in the household are close contacts. If a sibling of a student is positive, but you aren't sure about the student, that student is a close contact and would need to quarantine. Also, if you had direct physical contact with the infected individual, if you shared eating or drinking utensils, and if you were sneezed on, coughed on, or somehow got respiratory droplets on you from the infected individual. Other important points are that being in the same room, on the same athletic team, having a brief socially distanced conversation, or walking by an individual who is COVID-19 positive does not make you a close contact. Again, it's being within that 6 feet distance for 15 minutes or greater. I'd also like to point out that wearing a mask does not affect the determination of a close contact. While masks are very important to decrease the spread of the virus, quarantine is still required even if you are wearing one, they are wearing one, or you both are wearing one. The length of quarantine is always 14 days after your last contact with the COVID positive individual. That means if students were together on Monday, Tuesday, and Wednesday, Quarantine is going to start from their last day of close contact. So if they were together within 6 feet of distance for 15 minutes or greater on all Monday, Tuesday, and Wednesday, quarantine starts after Wednesday. So your date of exposure is day 0, and day 1 of quarantine starts the following day. So in this example, if Wednesday was close contact, day 1 of quarantine is on Thursday, and then you quarantine 14 days from there. Those identified as close contacts must complete the full 14-day quarantine, even if they feel fine and have no symptoms, and even if they have a negative COVID-19 test result. This is because symptoms can develop 2 to 14 days after exposure. Even with a negative test result on day 3, that doesn't mean that that you will stay negative. You will still have up to day 14 that the virus could make you ill. When asked to quarantine, your student should stay home. They can continue with school via remote learning. Your student's temperature should be checked twice a day, once in the morning and once in the evening. Please watch your student for symptoms of COVID-19. We urge you to strongly consider testing for COVID-19 if your student has been exposed. The Indiana State Department of Health suggests that this testing be done on day 5 of quarantine or after for the most reliable results. Contact your healthcare provider if symptoms develop and get tested. And please stay away from people, especially those who are higher risk for getting very sick from COVID-19 during your quarantine. I would like to point out at the bottom right-hand corner, when we're talking about quarantine, it says that an individual who is in close contact must quarantine for 14 days before returning to school. I wanted to point out that they must remain symptom-free during this quarantine. If an individual develops symptoms, then they refer to the symptomatic scenarios, so the ones over here. So if your student is on day 6 of quarantine and they have not had any symptoms up to that point, but on day 6 they start to have symptoms, then your student needs to start over with their time frame. They end up starting on that day, ends up being day 1 of a 10-day isolation then, because they have moved from someone who is in quarantine to someone who now is ill, and they must isolate for at least 10 days. They can return to school after at least 10 days have passed. They have had resolution of symptoms, and they have been fever-free for 24 hours without the help of fever-reducing medicine. There are 2 other scenarios on here I would like to just review briefly. One would be a situation where a student is tested and negative, but they don't have any symptoms. So this would be a situation where maybe your family just randomly got tested for COVID-19 for a reason, like you were going to be around somebody who was high risk and you wanted to make sure that you weren't ill. And so you got tested and their test was negative, and they aren't experiencing any symptoms. In this case, they are fine to proceed with attending school. The exception to this is if you're in quarantine, because if you're in quarantine, it does not matter if you have a negative result or not, or if you do not experience any symptoms. You must complete the 14-day quarantine, even if test results are negative and even without symptoms. The other situation would be if a student tested positive, but they were symptomatic, or I'm sorry, if they tested positive, but they were not symptomatic. This may occur if a family member was positive and then the student ended up getting tested. Maybe they were not exhibiting any symptoms, but their test ended up coming back positive. In this case, you would isolate them at home for 10 days from the day the test was taken. If at any time during that 10 days the individual develops symptoms, then isolation starts on day 1 of symptoms and you can start that time frame over. I did want to point out a very rare complication in children that is believed to be linked to COVID-19, though we are not exactly sure how at this time, and that is multi-system inflammatory syndrome in children. I just want to highlight the symptoms, which would be rash, red eyes, cracked and swollen lips, red and swollen tongue, swelling in the hands and feet, and stomach pain. I want to reiterate that this is very rare. It can show up later, weeks after a COVID illness or a COVID-19 exposure. There are still many questions to be answered about this condition, but I did want to just alert you to the unique symptoms that this has. So I wanted to review a few brief nursing office procedures as it relates to COVID-19. This year, because of COVID-19, students who are ill at school must be picked up within the hour. If we are unable to reach a parent and/or do not receive communication back from parents within 25 minutes, we will go ahead and move on to contacting the emergency contacts listed to arrange a student's pickup. We recommend that you update the emergency contacts now. Your emergency contact list should be someone that could physically pick up your student from school if you are not able to. And we recommend that you discuss your sick plan now. Please make plans now that you are able to use should your student become ill at school. And this is just due to the highly contagious nature of COVID-19. Again, if your student has an underlying medical condition such as seasonal allergies, asthma, or reflux that they sometimes exhibit symptoms for that can look like some of the symptoms of COVID-19, please turn in a physician's note stating such and indicating symptoms that they typically experience. This will need to be turned in to the health services and nursing office. During this time of COVID-19, no nebulized respiratory treatments will be given in the nursing office until further notice per the CDC and Indiana State Department of Health guidelines. Medication in the form of puffers, inhalers, or MDIs are absolutely able to be used and can be dropped off for your student. If you need to drop off medication for your student, please call health services to set up drop-off of this medication. Due to visitor restrictions at this time, parents are not able to come back to the nursing offices to drop off medications, so please email us or call us to discuss when a good time to drop off the medication would be. Parents, you are our first line of defense. You are so important. Keeping your student home when they are ill or quarantined due to exposure is the most important thing you can do during this time as a parent to help stop the spread. If you have any questions about illness, about when your student can return to school, or you need any help figuring things out, please call us. We are absolutely here to help you. We look forward to serving you and your family this year, and we look forward to working together with you to keep Heritage healthy.